Okay, good day. So, ito yung topic natin, more on common board questions. Okay?
Q&A for midwifery licensure exam. Pad of fatty tissues that lies over the symphysis pubis. Answer: Mons veneris. Two folds of adipose tissue covered by loose connective tissue and epithelium. Answer: Labia majora. A small rounded organ of erectile tissue at the forward junction of the labia majora, center of sexual arousal and orgasm in the female. Answer: clitoris. Almond-shaped area that contains the hymen, vaginal orifice, and Bartholin's glands. Answer: vestibule. Healing of torn hymen. Answer: carunculae mystiforms. External opening of the vagina. Answer: vaginal orifice. Muscular structure easily stretched during childbirth to allow enlargement of the vagina and passage of the fetal head. Answer: perineum. Middle layer, largest part of the uterus muscle layer for delivery process. Answer: myometrium. Muscle layer for menstruation. Answer: endometrium. Site of sterilization by lateral tubal ligation. Answer: isthmus. Outer third or second half. Site of fertilization, longest 5 cm. Answer: ampulla. The only period present in males wherein he cannot be re-stimulated for about 10 to 15 seconds. Answer: refractory period. Lower abdominal pain felt at the side of the ovary that released the ovum. Answer: meatus mers. Causes ovulation. The answer: upsurge of luteinizing hormone. The pink or reddish streaks due to stretching of abdominal wall causes rupture and atrophy of small segments of connective layer of the skin. Answer: striae gravidarum. Extra pigmentation, narrow brown line running from umbilicus to symphysis pubis and separating the abdomen into right and left hemisphere. Answer: linea nigra. Mask of pregnancy, increased pigmentation caused by melanocyte stimulating factor. Answer: melasma or cloasma. Change of consistency of cervix or softening of the cervix. Answer: Godel's sign. Change of consistency of isthmus or lower uterine segment. Answer: Hager's sign. Lower uterine segment is tapped sharply by lower hand. The fetus can be felt to bounce or rise within 16 to 20 weeks. Answer: ballotment. Term used for ovulation to fertilization. Answer: ovum. Fertilization to implantation, zygote. Implantation to 5 to 8 weeks, embryo. 5 to 8 weeks until term. The answer: fetus. Developing embryo or fetus and placental structures throughout pregnancy, conceptus. Gelatinous mucopolysaccharide gives bulk of the cord body and prevents pressure on vein and arteries that pass through it. Answer: Wharton's jelly. Ability of sperm to release proteolytic enzyme hyaluronidase to penetrate corona radiata and zona pellucida. Answer: capacitation. Part of the endometrium located under fetus portion where the trophoblast cells are establishing communication with maternal blood vessels. Answer: basalis or base. More than 2000 ml of amniotic fluid. Ultrasound will show pockets of fluid more than 8 cm. Answer: polyhydramnios. The layers that protect fetus against syphilis disappear between 20 to 24 weeks. After 24 weeks, critical might get infected with syphilis. Answer: Langhans layer or cytotrophoblast. Differentiation of primary germ layers: ectoderm, CNS, PNS, sense organs, sebaceous glands, skin, hair, nails, mucous membrane of the anus, mouth and nose, mammary gland, throat enamel. Mesoderm, supporting structures: connective tissue, bones, cartilage, muscles, tendons. Heart, circulatory, blood vessels, lymph vessels. Reproductive system, dentin of teeth. Endoderm or entoderm, lining of RPT, respiratory tract, pericardial, thyroid, thymus, lower urinary system, bladder, and urethra. Exercise that relieve backache by making spine more flexible. Answer: pelvic rocking. Late sign of fetal hypoxia. Answer: bradycardia. Transitory decrease in heart rate caused by uteroplacental insufficiency. Answer: late deceleration. Transitory decrease in fetal heart rate caused by umbilical cord compression. Answer: variable deceleration. Decreased alpha-fetoprotein usually associated with. Answer: Down syndrome. Increased AFP usually associated with. Answer: neural tube defect or spina bifida. Woman who is or has been pregnant regardless of pregnancy outcome. Answer: gravida. Refers to past pregnancies that have reached viability. Answer: para. Systematically observing and palpating the abdomen to determine fetal presentation and position. Answer: Leopold's maneuver. What do you call the first maneuver? Answer: fundal grip. The second maneuver: umbilical grip. Support the uterus during the late months of pregnancy and aids in directing the fetus into the true pelvis for birth. Answer: false pelvis. Forms the passageway of the uterus during labor, consists of inlet or pelvic brim, pelvic canal, and outlet. The answer: true pelvis. Imaginary line that divide the false and true pelvis, drawn from the sacral prominence at the back of the pelvis to the superior aspect of the symphysis pubis at the front of the pelvis. Answer: linea terminalis. Excellency Review Center. Distance between the midpoint of sacral promontory and lower margin of symphysis pubis, measured by internal examination. Answer: diagonal conjugate. Distance between the midpoint of sacral promontory and the midline of symphysis pubis, which is ascertained by subtracting 1 to 1.5 cm from the diagonal conjugate? Answer, obstetric conjugate. Space between fontanelles. Answer, vertex. Found at the junction of the main suture lines compressed during birth to aid in molding of the head. Answer, fontanelles. Important in birth as membranous interspace, they allow cranial bones to move and overlap, molding or diminishing the size of the skull. Answer, suture lines. Joins the two parietal bones of the skull. Answer, sagittal sutures. Line juncture of the frontal bones and the parietal bones. Answer, coronal sutures. Most favorable and common fetal position. Answer, LOA. Most frequent presentation, 95%. Fetal head is the body part that will first contact the cervix. Answer, cephalic presentation. Causes cervical dilatation. Answer, uterine contraction. Shortening and thinning of the cervical canal. Answer, effacement. Enlargement or widening of the cervical canal. Answer, dilatation. Occurs when newborn head or presenting part appears at the vaginal opening. Answer, crowning. Placenta separates first at its center and lastly at its edges. Answer, Schultz placenta. A woman is passive, letting other people do things for her and make decisions for her. In Rubin spaces of puerperium. Answer, taking in phase. The phase where the woman begins to initiate action herself. Answer, taking hold phase. Occurs after new mother returns home. The woman finally defines her new role. Answer, letting go. Uncontrollable vomiting during pregnancy that results in dehydration, weight loss, and ketosis. Answer, hyperemesis gravidarum. Implantation of the placenta over the or near the internal os of the cervix. Answer, placenta previa. Covering the internal os completely. Answer, total placenta previa. Premature separation of normally implanted placenta from the uterus after 20 weeks gestation. Answer, abruptio placenta. Implantation occurs in a site other than the endometrial lining of the uterine cavity, in the fallopian tube, cervix, ovary, abdominal, or pelvic cavity. Answer, ectopic pregnancy. Folic acid antagonist, chemotherapeutic agent, attacks and destroys fats growing cells. Answer, methotrexate. Termination of pregnancy before the age of viability. Answer, abortion. Classification, expulsion of all products of conception. Answer, complete abortion. 3 or more consecutive spontaneous abortion. Answer, habitual or recurrent. Expulsion of some products of conception. Answer, incomplete. Undetected death of an embryo or a fetus that is not expelled and that causes no bleeding. Answer, misabortion. Before 12 weeks gestation. Answer, early abortion. Non-induced abortion. Answer, spontaneous abortion. Vaginal bleeding occurring before 20 weeks gestation without cervical dilatation and indicating that spontaneous abortion may occur. Answer, threatened abortion. Termination of pregnancy because the woman's life or health is endangered or because the fetus is dead or has malformation incompatible with life. Answer: therapeutic abortion. Vaginal bleeding or rupture of the membrane accompanied by the dilatation of the cervix. Answer: inevitable abortion. Termination of pregnancy for medical or elective reasons. Induced abortion. Serious infection of the uterine content during or shortly before or after an abortion. Answer: septic abortion. Abortion between 12 and 20 weeks gestation. Answer: late abortion. Abnormal pregnancy resulting from developmental anomaly of the placenta, conversion of the chorionic villi into mass or clear vesicles. Answer: hydatidiform mole. Malignant transformation of chorionic villi into cancer cells that invade and erode blood vessels and uterine muscles. Answer: choriocarcinoma. Labor that begins after 20 weeks gestation and before 37 weeks gestation. Answer: preterm labor. Descent of the umbilical cord into the vagina ahead of the fetal presenting part with resulting compression of the cord between the presenting part and the maternal pelvis. Emergency situation, immediate delivery will be attempted to save the fetus. Answer: cord prolapse. Arrest of spontaneous delivery of shoulders secondary to impaction of the anterior shoulder against the symphysis pubis. Answer: shoulder dystocia. Uterus turns completely or partially inside out. It occurs immediately following delivery of the placenta or in the immediate postpartum period. Answer: uterine inversion. Uterus is soft, baggy, or difficult to palpate, not contracted. Excessive vaginal bleeding occurs. Answer: uterine atony. Drug of choice of eclamptic patient. Answer: magnesium sulfate. The drug that present at bedside is answer: calcium gluconate. The drug of choice for pre-eclamptic patient. Answer: apresolin sulfate. Apresolin lang. Hydralazine. Okay. Signs of placental separation. 1. Lengthening of the umbilical cord. Sudden gush of vaginal blood. Change in the shape of the uterus. Form contraction of the uterus. Appearance of the placenta at the vaginal opening. Stages of labor. First stage. Stage of cervical dilatation. Second stage, fetal expulsion stage. Third stage, placental stage. Fourth stage, recovery or homeostasis. At first stage of labor, latent, active, and transitional. Latent or latent is 0 to 3. Active 47 cm, transitional 8 to 10 cm. Occurs when newborn's head or presenting part appears at the vaginal opening. Answer: crowning. Mechanism of labor. Edifier ere. Downward movement of the biparietal diameter of the fetal head to within the pelvic inlet. Answer: descent. Head bends forward onto the chest, making smallest anteposterior diameter the one presented to the birth canal. Answer: flexion.
Okay, thank you. Thank you for watching. Please like and subscribe.